Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, October 8th, giving you the update from Albany Medical Center. Fred, let's begin with this. Yesterday there was a very significant storm in the region, for sure. Yes. And we've mentioned this many times in the past. We are a large campus with buildings in a lot of different places.
And a lot of different communities.
A lot of different communities
as well.
And our facilities team did a remarkable job yesterday making sure that power where it was knocked out was restored again quickly so that care could be delivered in all those places.
They did a tremendous job. Thank you guys for that hard work.
Yeah, for sure. Thank you so much. Let's talk about COVID. First graph up is the capital region, the 8 counties. Fred, we've been talking about this for a while now. We're seeing an increase in the number of admitted people in the capital region for COVID. Today's number is 28. Looking at that graph, obviously we've been higher before, but we are definitely trending up.
Yeah, Dennis, we are. On yesterday's regional call, it seems to be centered here in Albany, St. Pete's, and us primarily, a little bit in Saratoga. But there's definitely an upward trend on that graph.
So I think the message back to our workforce is, we have to remain vigilant, keep doing the things we're doing. We also thank you for those who are caring for people with COVID and quite frankly, everybody. And to the community, I think we'd say, these numbers, we're watching them. We've got to continue to do what we're doing.
Don't get fatigued.
Right.
Wear your mask, social distance, wash your hands.
Right. So what does that mean back here on this campus? Our morning census, we currently have 12, 7 on the floor. I think it's 5 in the ICU and one on a ventilator. On a ventilator.
Yep.
All right, changing topics, Fred. We like to call out when it's a week or a day or a month that celebrates members of our workforce. This is National Physician Assistant Week, and we obviously want to recognize that incredible professional part of our workforce.
They're a very important part of our staff. They do a lot of very important things in the hospital, assisting in the operating room, seeing patients in the ED, rounding on the floors, discharging patients, admitting them.
Yep.
Very, very important.
Right, and we of course have a PA school here, a great one.
Tremendous.
Many of the graduates stay on and work with us, and so therefore we just want to congratulate them on their week. Fred, you received what I thought was an incredible letter the other day, and I thought you wanted to share it with people here today, and it has a really nice message in it.
It really does. Dennis, nothing can make my day better than receiving a letter from a family, a patient, someone about their experience here at the medical center. It's been positive, and we get those frequently.
We do.
So this one is about a patient with special needs, with autism, who was injured, came into the emergency room, was ultimately admitted on C8. And this individual's parents just were absolutely overflowing with their praise. They call out the care that was administered by the entire staff, including the doctors, the nurses, the technicians, the food service folks, the custodians, and the PSAs. They were amazing. They said not knowing about their daughter's diagnosis, it didn't matter. There were no delays. Everything she needed was provided. Wow. Just really great. So real shout out to the emergency department for tremendous care and to all the folks on C8. Thank you very much.
Yeah, for sure. Thank you very much. And thank you to the family that wrote the letter. When we get those letters, it really does help us to validate the good things that we're doing.
Absolutely.
And so thank you for that, Fred. So the last topic we want to talk about today is about the union and about the information that we have been talking about recently about the potential for a strike on this campus. As we mentioned the other day, Fred, there was a sheet published with some FAQs, frequently asked questions and answers to them, and that has been distributed, and we know the nurse managers are bringing those to the unit level and sharing those with the nurses. We wanted to pull out a couple things from that and discuss them here in this video today. So let's start with this first one. A couple nurses have said, am I in the union? So let me start and I'll let Fred pick it up from there. So we know all of the nurses are part of the collective bargaining unit, but you're only in the union itself if you signed a union membership card.
That's right.
Some nurses have come up to me and said, I've signed a lot of things over the last year and I can't remember if I signed a card or not. So what would be your response to a nurse who said that?
I would say if you've signed anything from a union rep, you should assume that you're in the union, and if you don't want to be in the union, So let's say if there is a labor action, if there is a strike, and you want to cross the picket line without being fined, send a letter resigning from the union.
And that nurse can do that today. They don't have to wait for the notification of a strike. They can do that today.
That's right. And you know, Dennis, I heard that on one of the units, a whole bunch of nurses got together and all of them put their name on the same letter and sent that to the union.
Which is
so that's another way to do it.
That's legally permissible.
Yes.
It's suggested you should send it in as a certified letter, as proof that it has come in. Keep a copy of that letter.
That's right.
Okay, so that would be what would happen if they're unsure if they're a member of the union, or if they are a member of the union and wish to notice them that they no longer want to be in the union. The next question, Fred, is about a lockout. Now, the New York State Nurses Association has given out literature, which has been read by many people, that says that if there's a strike on this campus, it's going to be a one-day strike.
That's right.
Now, you and I and others have spoken about this quite a bit. Interestingly, though, there seems to still be some confusion out there among our workforce. So let me ask a very straightforward question. If there is a one-day strike, will the medical center lock out its nurses?
No. We don't intend to lock out the nurses if there's a one-day strike.
Well, we would not lock them out. Okay, very good. So that means that if you're a nurse and you work at Albany Medical Center and there is a strike, you would be allowed to work. I would go so far as to say we would encourage you to work. We would like all of our nurses to work.
We have tremendous nurses. We want them at the bedside taking care of our patients.
Now, we will have to have replacement nurses also here.
That's correct.
Because obviously until the day of the strike, we won't know how many nurses will be prepared to show up and work. But if a nurse wishes to work that day, it would be allowed legally, and we would encourage it. So there would be no lockout.
And Dennis, I want to emphasize those replacement nurses.
Right.
We've worked on a plan for many, many months. We're working with a group that does this around the country. We are absolutely certain that if we need those nurses in this building, they'll be available to us.
For sure. And on that last topic about working that day, one of the advantages, if you are in the union or you think you might be in the union, of noticing them that you no longer want to be in the union, is that on strike days, when people are in the union and they choose to work, historically, those nurses are fined by their union.
That's right.
And so if you want to be sure that there's no chance that you would be fined for coming into work that day, the way to do that is to resign from the union.
And typically those fines are your wages for that shift, that day.
Last topic, very important, harassment. Fred, we have a zero tolerance rule on harassment here at the medical center.
That's right.
And there are rules specifically as they relate to union activity when it comes to management and when it comes to the union. So those rules are you can't, what they say, do surveillance or spy on people.
That's right.
You can't pressure somebody into doing something. You can't interrogate them. And you can't threaten them. So those are rules that we live by here when it comes to dealing with our workforce.
Right.
It goes both ways, though, right? We don't want members of our workforce to feel threatened or harassed by other coworkers about whether or not they're going to strike or not.
That's right. And we have heard that some of our nurses feel like they are being harassed. If you think you're being harassed, if you feel that you're being pressured, you do have recourse. You can go to HR and file a complaint about that harassment. We would encourage you to do that.
And Fred, obviously it's important for us to get our information out there. That's why we're using this video. We also believe that it's important for information to be delivered at the unit level by the nurse manager. And my understanding is that we're also going to be giving out information at the entrances coming in and out of the hospital. We're going to do it in a non-threatening way, a non-harassing way, but we want to have information that we can give to our nurses if they want more information.
So Dennis, we want the nurses to know their rights, and that's what we're going to say. You should know your rights. We're going to hand out those FAQs to make sure that everyone has an opportunity to see them. There won't be any pressure associated with that. It's a simple, we want you to know your rights, have a nice day, and handing those out to nurses as they come in or leave from their shift.
All right, very good, very good. All right, Fred, thanks for clearing that up. And I guess I would say to anybody out there, after watching this video, if you have any questions at all, please do not hesitate. Talk to your nurse manager, and they'll get you the information that you need.
Absolutely.
All right. So we're rolling into the weekend. We'll be back again on Tuesday. Again, thank you to our facilities folks. We're up and running in all of our sites, and that's very important. To members of our workforce who will be here this weekend, we thank you very much. And once again, we ask that you please take care of yourself, take care of each other, and we'll see you next week.